Okay, well, hello and welcome to our Pharma Talk this morning. I have a little bit of an introduction, which will give people some time to walk back, but thank you all for attending. We have our McKesson ideaShare Pharma Talk this morning, where you're going to have the opportunity to learn more about how Health Mart Pharmacies can become credentialed providers of patient care. I'm really excited about these opportunities. So I'm Suzanne Feeney, nice to meet you. And I'm one of the vice presidents of pharmacy retail operations for the Midwestern region. I'm a pharmacist, and I get the opportunity to go out and visit with pharmacy customers who are Health Marts and talk about this wonderful program that these two gentlemen are here to talk about today. So it's my pleasure to really introduce Ben Blummel. Ben is the Executive Director and Senior Vice President for Research and Innovation at the American Pharmacists Association Foundation. Ben, I know, has led practice-based research for decades, since 1996, so tons of experience designing effective patient care models and spearheading those initiatives like Project Impact, which we're going to talk about today. We also have Jonathan Little here. Jonathan serves as the Director of Practice-Based Research at the APhA Foundation, and he graduated from the University of Oklahoma College of Pharmacy, where he is actively involved in several leadership roles. His work at the APhA Foundation includes managing research projects and that demonstrate the success that you all have and making sure that's published in the literature. So I'm now going to turn the session over to our guests on how we can truly create an impact in our pharmacies.
Great. Well, thanks, Suzanne. Really appreciate it and appreciate the opportunity to be here this morning, and also appreciate each of you for being here early as the exhibit hall opens. So at any rate, we're going to dive right in. We've got there are multiple projects that we have offered out to Health Mart and Health Mart Atlas pharmacies for opportunities to participate. And John's going to talk about the active projects that are currently in field. But what I'm going to talk about first is the opportunity that you have to sign up today and enroll. We have a new process that we want to ask everybody to follow. And so if you're interested today, last year we had a QR code on the screen. You scanned it, you went and filled out a form, and then we had different ways of communicating with you, both from the APhA Foundation team and from the McKesson team. And so we've optimized that process this year, and McKesson has a booth number 1012, so you might want to write that down. If you're interested in signing your practice up to be eligible to participate in the Diabetes Prevention Program initiative, if you go to that booth, they'll plug you into a form that you can complete right here on site. Once you complete that form, there'll be a link that will take you over to our APhA Foundation form. You'll complete that form, and once you complete that form, you'll get some information and some feedback about what the process will be from that point going forward. So hopefully this will streamline things, and what it does is it helps McKesson from a Health Mart and a Health Mart Atlas perspective to know who's interested and who's basically moving on to request or provide additional information about your practice to the APhA Foundation, and then we'll take it from there. And so we have a whole process that we go through on our side to evaluate and make sure that it's a really good match for your site and for this program. So without further ado, let me talk about this program. So imagine that you could train your technicians and or your pharmacists up in your site through a lifestyle coaching program through the CDC. And once you've done that if you've signed up with the APhA Foundation to participate in our Impact Diabetes Prevention Program, that you would be able to have your team be paid as providers of Medicare DPP services, no legislative changes required. Well, that's what we have going on, because the APhA Foundation has just concluded a 6-year pathway of participation with the CDC in an initiative called 1705, which was scaling the National Diabetes Prevention Program initiative into underserved communities across the United States. And right now, today, as we sit or stand here, there are only 11 organizations who've received a CDC designation as an umbrella hub organization, and the APhA Foundation is one of those. So instead of your pharmacy having to go through a whole process where you would register with the CDC, you would go through a whole qualifying process, you would have to go through 12 plus months of patient care, and then through another both data and on-site evaluation process to get your full recognition as a DPP site so that you could actually submit for payment. You can join underneath our umbrella hub, and essentially you immediately are fully recognized because you're operating under our umbrella, which has full recognition status already. And right now, today, we have also Medicare DPP supplier status in more than half of the Medicare administrative contractor regions throughout the country. So that's another hurdle that your practice would have to go through individually, is to sign up as a Medicare supplier for DPP services with CMS. And one of the challenges that a lot of the pharmacies, when we were in our 6-year initiative cooperative agreement with the CDC, had was they had DME registrations with CMS, and CMS would get confused between your DME registration and your DPP registration, and it would put your DME at risk possibly in terms of what we understood from a few of the pharmacies who participated. So this keeps the whole process super clean, and basically the way that it works is that you come into our program under our umbrella hub, you participate, you deliver this lifestyle change program, which is evidence-based. And so it's basically a year-long program. Patients have the opportunity to participate for the first 6 months in basically every other week classes, and then monthly classes for the last 6 months. There are a total of 26 class opportunities in the course of a year, which comprises about 24 hours of their life. And what the data says is that for patients who complete 85 to 90% of those classes in your practice with a trained lifestyle coach, they will not go on to develop type 2 diabetes. So it's a really incredible statistic, an incredible opportunity for our profession to be a part of helping to prevent diabetes throughout the United States. And we're really excited from an APhA Foundation perspective and in our collaboration with McKesson, Health Mart, and Health Mart Atlas to be able to bring the program to you and your pharmacies, and we're super excited about it. The other thing is that the revenue opportunity you can see on the screen per patient, if somebody were to participate and attend all of their classes, your revenue opportunity is a max of $578 per person with the way that it works out under our umbrella hub. Say they attend 80 to 85%, that's about $500 per participant. If you had just 2 cohorts with 20 people enrolled in those cohorts, and you had a pharmacy technician delivering that program part-time, that would be $20,000 of revenue right away. And so if that pharmacy tech also was fully engaged, they could be delivering up to 10 to 12 classes at a time, and that would actually produce even more significant revenue in your practice. And again, this is a great opportunity because we don't have to change legislation for you all to be paid by CMS as providers of Medicare DPP services. So at any rate, that's the short story on this front. I'm going to turn it over to Jonathan now and let him tell you about some historical projects that we've enrolled practices in and some things that are going on right now. So Jonathan, over to you.
All right. Thank you, Ben. And hi, everyone. Very excited to tell you about some of our active projects at the APhA Foundation. As you can see here on the screen, there's 3 that I'm going to go over with you today and show you the great work that pharmacists across the country are doing. And so this first one, as you can see, is Project Impact Cardiovascular Health Plus. This is a very unique, innovative project that I'm really proud of. We have 40 pharmacies across the country in various states that are participating right now. And so basically the overarching theme of this project is that the pharmacy performs an EKG for the patient right there in the community pharmacy. And so the great thing about this as you can see, Ben is holding the EKG device. This is a medical grade FDA cleared device. And so the patient does not have to wear 12 patches, and you don't have to hook them up to anything. They simply hold this device for 30 seconds, and it provides an EKG assessment right there in the pharmacy. So how cool is that? And so one thing that I like to clarify is that the pharmacist is not diagnosing AFib, right? There's nothing that's out of scope. We are simply performing an EKG screening, and if the determination is AFib or another abnormal heart rhythm, then the pharmacy will refer that patient to a provider for further evaluation, okay? And so we at the APhA Foundation pay the pharmacist for that service, for conducting that service. And so a couple of other cool things about this project in particular, the plus on Cardiovascular Health Plus stands for our Social Determinants of Health screening tool. And so we have a psychometrically validated survey tool that the patient completes, and the pharmacist will review their results and discuss any determinants of health that may be applicable to that patient. They'll discuss that with them and perhaps refer them to resources in their community or resources nationwide, perhaps a caseworker in their community, if applicable, to help kind of close those gaps and address those determinants. So yeah, this project is really cool, very innovative. It builds upon other work we've done at the foundation in the past, and just kind of as a, and so since these projects are active and ongoing, we can't really describe any results right now because it's underway. But I can say that this project builds upon work we've done at the APhA Foundation in the past, in which the pharmacies actually found about twice as much prevalence of AFib than would be expected in the country nationwide, which is about 1%. And the pharmacist screening actually helped those patients to determine or see that they may have AFib and go to their physician to talk about it further. And another really cool thing about this project, as you can see there on the slide, is that something that's very important to us at APhA and the APhA Foundation is that we are credentialing and paying pharmacists just like their physician colleagues. What a concept, right? So we've partnered with APHA's Pharmacy Profiles. Maybe you've heard of it, but without going too far off on a tangent, essentially it's a place where pharmacists can input their license number, NPI, any other advanced credentials. Maybe they have immunization certificate or test and treat certification. And basically, it's kind of a clearinghouse for the pharmacists to have all this information in one localized place in hopes that payers will recognize this is a valid provider who's providing great care and should be paid, or maybe, depending on your state, maybe is required to be paid just like other providers. So that's something we're very passionate about there. The next project is Project Impact HPV Immunizations. This project also builds upon some great work we've done in the vaccine and immunization space at the APhA Foundation for years. But essentially, this project is aiming to increase HPV vaccinations when appropriate. So as you may know, patients who are up to 45 years old could be eligible for the HPV vaccine, basically age 9 to 45, with some shared clinical decision making. So this project seeks to close the gaps for people who may be eligible for an HPV vaccine. And so what the pharmacy does is they'll check their state immunization information system, discuss the gaps that they see in the IIS with the patient, and say, hey, it looks like you might be due for a number of vaccines. Maybe it's HPV and Tdap and the flu shot. And so the pharmacist is closing those gaps with the patient and talking to them about what they're eligible for. And so performing that assessment of the patient's immunization status and talking to them about it, we pay the pharmacy for performing that service, okay? So the pharmacy is not getting paid extra for actually delivering the shot, although they can bill that like normal. What we're paying for in this project is performing that vaccination review and patient encounter. And so this is a really great project. We have pharmacies all across the country who are, of course, trying to help patients catch up on their HPV vaccines when appropriate. And as you can see, there is some progress so far that we are making significant headway in that regard, and closing vaccination gaps, not only for HPV, but for all the other vaccines as well that the patient is due for. And finally, Project Impact Test and Treat is a new initiative that we're very excited about that we've got pharmacies, again, all over the country participating in. And so I'm not sure if your state can perform test and treat services. It's kind of a mixed bag. I think there's roughly 15 to 20 states across the country that can perform test and treat for all three of these illnesses here, COVID, flu, and strep. But there is progress being made nationwide on that front. I think even just this month, Illinois now can perform test and treat, pharmacies can perform test and treat services. And so, yeah, what we're doing is we're equipping the pharmacy with the testing instrument and tests, having them perform the test with the patient, and prescribing, the treat part, prescribing medication if appropriate according to the results of that rapid molecular test. And so, again, the pharmacist is paid for performing that service. It's about $70, which is pretty great for a community pharmacy, I think, to be making that kind of money on performing that test and then obviously dispensing the medication and billing the medication side like normal as appropriate. So that's a quick overview here of the three projects that we've got going on. Did I miss anything you'd like to add?
No, well, I think that maybe that to just let people know that these three projects have gone in field since this meeting last year that was in Las Vegas, and there are over 85 pharmacies participating in these three initiatives, the vast majority of which are Health Mart and Health Mart Alliance pharmacies. So we've got a pipeline. Right now, Medicare DPP is the big opportunity, and we've got plenty of room for lots of pharmacies there. And we're encouraging people to jump in this year. And we've got three other projects that are in our pipeline that we expect to be talking about in the coming months. So really love to have everybody sign up and make sure that you're on our list so that when we've got new opportunities that present, we can reach out to you. Back over to you, John.
Absolutely. So we wanted to show you one quote from a pharmacist in Wyoming who is involved in the Project Impact Cardiovascular Health Plus. So I'll read this briefly. I wanted to tell you we have caught several of our patients with AFib, and after their initial shock of them then going to their provider, they have come back and thanked us for having caught it. People have been really thankful it was caught early, so thank you for helping us to be able to help our patients. And so this is something I'm super proud of. It's the pharmacists in the field, in the pharmacies daily, who are really doing this work and talking to their patients and making a true impact. But I am very proud that, because of our innovative projects and the compensation that we're giving to the pharmacists for doing this great work, that stories like this are, coming to light. So I'm very proud of that and think it's really fantastic.
Yeah, so now we want to open it up for questions. Happy to answer anything. Yep, Mark. Oh, we got mics.
Hi, thank you. My question on the lifestyle changes, does the physician, do they have to authorize the patient for the service, or can the patient come in, be introduced to the service? Of course, you want to make sure you let the physician know that you're doing this type of thing, but do they have to first see their physician, have the physician authorize it before they can start the program?
No. Basically, this is something that you can offer from a marketing perspective in your pharmacy. And in fact, in this CDC program, they don't even refer to the people who are participating as patients. They refer to them just as participants, okay? And so, so this is something that you can do from a prevention perspective in your practice that you can get started. And then to the point that you were making, Mark, you can follow up with the patient's physician to make sure that the whole team understands that, hey, this patient is now participating actively in a diabetes prevention program at your pharmacy. Other questions?
What would the cost be for the pharmacy to obtain the diagnostic device for the EKG?
So that's one of the things that's really cool. This is available over the counter, and you can go to Amazon.com, and the highest price you'll pay for it, it's a CardioMobile 6-lead device. $129. Okay, and what we did in the first, we had a project that preceded this one that John was referring to, and basically we armed the pharmacies during the pandemic with 2 of these devices. And then it was super scary because it's like, well, we had to clean the device between each time. But at any rate, on the back, it's got a couple of little screws. It's got a lithium 2032 battery in it that you can replace. And that's really the only thing that we've had go wrong with them is the batteries just run down and you got to replace them. But at any rate, it's good to have a couple in your practice, and then you can alternate back and forth if one of them does have a problem, or if you've got multiple patients. A lot of times we see couples, where both, people want to get screened, and then you're all set to go, and it's easy. So now in our projects, this is all free of charge to you all. You all typically you get a project stipend, a few $1,000s to help you with setup and things to get ready to get going. You get everything that you need. In that case, you get these devices, and then we've got a set of web-based resources and tools that are available to you. Yep. But the best thing is that for each assessment that you do, when you log it into the system, the month, on the 5th of the month following the previous month, we look at the data that you've entered into the system, and we basically generate an automatic invoice, and then we direct deposit money into your bank account the 3rd week of that month typically for those services that you documented that you delivered that previous month. And that's generally how most all of our projects work.
Amazing, amazing. Thank you both so much for going through the details of this. We do have another Pharma Talk beginning on the other side of the stage here in just a few moments. I'm never one who likes to stifle questions, so these 2 have graciously said they'll stick around for a few minutes, but really, you can hit them at their booth. So if you go to the community center or the apothecary, you can go over and ask more questions and actually fill out the form to register. So I hope I see all of you over there, because this is just a great opportunity to get your pharmacies signed up to potentially be part of these programs and be paid at provider rates for the services you offer in your pharmacies. So thanks so much, and I hope to see you on the other side where we'll be talking about community health workers.